Chapter 7, Expectations. Okay, so let's take a breather for a second. We've covered problem, whose problem it is. We've covered the buckets and the way to put their problem into those four different buckets. We've talked about putting your solution into those four buckets: clinical, operational, strategic, and financial. But there's a couple of ways you want to actually do it, because if you're a doctor or nurse, you can say it any way you want. But if you're an industry, salesperson, all the way up to the CEO, we can't just make claims. But if we use the voice of the customer, we can help summarize what they expect to get out of it. So again, when we talk about expectations of the outcomes that are anticipated if they were to approve our product to help with their problem, the business's problem, we can't make a lot of claims. We don't have that kind of data usually. But if you ask the clinicians, they're saying, yes, Mark, I want to use this to decrease the risk of infection. That's one of the reasons I'm using it. Summarizing the voice of the customer. So everything we would quote comes from the doctors, the nurses, and it's what their expectations are, because we would actually summarize it in their voice. Now, how do we do that? Well, we're going to be humble. We're going to be conservative. When these expectations are being described, we do not want best case scenarios because we're predicting the future. We want people in 2 years saying, hey, we approved those Fetzer valves. How are they working out? And we want our customers to say, wow, even better than we imagined. Not, I wish they were as good as we thought they were. We do not want that. So we want to be humble. We want to be conservative. And when our clinicians, our voice of customer gives this, we want the expectations to be tempered. We want to use terms like we anticipate, we expect. Conservatively, we anticipate these types of outcomes. We expect our surgical cases to be more predictable. We expect wait time in the ER to shorten. We expect that we'll need less respiratory techs per patient because our technology allows us to monitor better. Now, I'm making these up, but you'll notice I'm predicting the future and I'm being conservative and I'm saying we anticipate because there is no proof in the future. Finally, you may be wondering, well, how do we say all this stuff? Where do we get all this stuff? And that's a different course. But we are going to do an executive business summary, and we have built the vast majority of it. So understand that this is all going to be summarized, all on 1 to 2 pages, and something that can be read out loud in 60 to 120 seconds, as if you're at a VAC meeting. So this is leading to one good-looking, summarized, with a bow on it, plan for approval.